Hello, hello! Welcome back to Brenda's Books. This season I will be narrating for you the future war love story, Sara's War, which you can also buy a printed copy and a digital copy at Barnes & Noble and on Amazon. This is Season 2, Episode 6, and today I will be narrating for you Chapter 7 from the future love story, Sara's War. Here we go. Chapter 7, Emergency. Buzz. The sound of my alarm practically pitches me out of bed. I slam one hard fist on the off button. It's awful waking up terrified. You would think being in a war for this long would change what startles me. I peer over my nightstand to see if I woke up Lexi, but she is already up and gone, her bed neatly made. I rub my eyes and slide my feet off the bed into the floor. I really do not want to work out today. At that instant, I hear a familiar vibrating sound. I take one step to my lab coat, hanging from my bedpost, and pull my phone out of the side pocket to read a new text from the shared cell phone in relief. Emergency. Come to relief. Again? Who could possibly have gotten hurt at 6 o'clock in the morning? Then a grin spreads across my face. No workout today. I stuff on my old green uniform and brown tennis shoes, internally cursing whoever stole my army boots on the airplane. I grab my lab coat and quickly push my arms through the sleeves and dart out the door. As fast as I can, I scurry down the stairs while I slop my hair back into a messy ponytail. When I finally open the door that leads to relief, I find a familiar redhead pacing the hall. Randy? At first I'm surprised to see him, but then I remember he's the one I asked to take the early morning shift. His head pops up, and he immediately jogs toward me. He just started screaming, and I'm afraid... Who? Where is he? I say, holding my palms toward him. Harrison, he says in a pant, pointing his head across the hallway toward Surgery A. I dash into the room where Harrison lies on his back on the solitary bed. His face seems to be locked into a permanent cringe. You're hurting, Petty Officer Harrison? I ask, putting my hand on his forehead. Wow, he is hot. Harrison twitches and bellows in pain. I'll take that as a yes, I mutter. I squat next to the Doppler blood flow monitor that's mounted onto the bed rail so I can listen closely to the sound waves over the bellowing. Yep, definitely abnormal. I grimace. This is not good. A blood clot? Randy asks. Yes. Bring the x-ray over, please, I say as I stand up again. Where does it hurt? I ask Harrison. He puts his hand over the left side of his neck, close to his blocked artery. I resist another grimace. I was afraid of that. Randy slides by my side with the x-ray, and I click an image of Harrison's neck. Fortunately, the petty officer still has dye in his blood from yesterday, and the blood clot is easy to detect. Unfortunately, my assumption is correct about where the blood clot is. Get me some anesthesia, Nurse Reynolds, I say. We need to put him out for this. What? Randy whispers. I turn and look him straight in the eyes. He stares back. After a brief moment, he nods and hustles out the door. I slap on some white gloves, inhaling their clean latex odor. You have a blood clot, Petty Officer Harrison. I'm going to remove it. We'll put you out for the procedure, okay? You won't feel a thing. Harrison nods. His breathing is erratic, and I can tell he is trying to hold back any audible signs of pain. Then in comes Randy, dragging an IV behind him. When Harrison is sound asleep, I mark where the incision will be on Harrison's neck. Is the blood clot blocking all of his blood flow? Randy asks. No, just partially. Then why? Because the blood clot is right beneath the blockage of plaque in his artery. When the clot tries to move around the plaque, it will occlude the blood flow completely, and he'll have another stroke. I'm not willing to wait and see if he survives a second one. Randy seems a little too intrigued. So, if you can remove the blood clot, can you remove the plaque too? That's the plan, I say, my voice calm, even though my stomach is twisting in knots. Have you ever done this before? Randy asks, with a failed effort at nonchalance. My hands sweat inside my gloves. No. Then how do you know what to do? Randy asks, keeping his tone light. I read a lot, I reply. My heart pounds harder and faster. My pulse throbs in my throat. Randy opens his mouth to speak again, but I cut in. "Stop talking, Nurse Reynolds. I need to concentrate." Randy is silent as I work, fetching me whatever tool I request. It feels good to have a quiet, responsive companion. In fact, he's probably the reason I'm able to keep my head on straight. As the surgery presses forward, the more relaxed I feel. And for some strange reason, something my dad told me a long time ago comes to mind. "Ah, I see you found your groove," he had said. "Nothing is going to stop you now." I was 12 years old and had just come off the dance floor to meet my dad after my audition for the Nutcracker. He had been watching me from the auditorium seats. I was super nervous about this audition, but afterward, I knew I had nailed it. My dad agreed. I feel the same way at this moment. In fact, I'm surprised to realize that I actually enjoy slicing through an artery, as morbid as that may seem. But it's true. The size and the feel are so intriguing to me. I once thought there would never be anything more fascinating to me than an eye. But I'm rapidly proving myself wrong. Arteries, blood vessels, they are a close second. I inhale the smell of my latex gloves again. It's comforting, relaxing. The diagrams in my head are clear, and the measurements I conclude are precise. "You found your groove, Sara," I tell myself with a smile. Perhaps even in this world of wars, there really are still miracles. Chapter 8. Guilty. As I stitch up the last suture on Petty Officer Harrison's neck, an enormous wave of relief rushes over me. My mind feels as hot as coals, but I also feel like a massive burden has been lifted from my shoulders. I toss my gloves in the trash with a huge smile on my face. Randy is smiling too. "Was that incredible or what?" I exclaim. It's all I can do to keep from jumping up and down like a toddler. "It was pretty amazing," Randy says with a smile. "He made it! Harrison is better than he's been in years, I bet. Wow, that was fascinating, don't you think?" Randy chuckles and nods. He seems to be amused at my sudden enthusiasm. I feel as light as air. "I almost want to do it again," I cry. It's a little strange that I'm expressing all this to Randy, but I can't help myself. I am so happy and so relieved. Randy laughs more openly now. "I think I've had enough," he admits, tossing his own gloves in the trash. "You did a great job, though, Doc. Really." "Thanks. I'm so happy it went smoothly. We should probably call Harrison's wife now." "I already did, and Colonel Haskins too," says Randy. I peer through the transparent glass walls to see Mrs. Harrison standing in the hallway talking with Nurse Sanders. She's waving her arms with short, rigid movements. The Colonel is nowhere to be seen. I turn to face Randy. "When did you call them? We finished the surgery not 6 seconds ago." "I called them while you were sterilizing the tools," Randy tells me. "I'm not surprised you didn't notice. I've never seen anyone so full of concentration." I grin at that. It was awesome being in my own surgical bubble. "But why did you call the Colonel?" I don't want this feeling of elation to get smothered by more awkward conversations. Randy gazes at me for a moment, looking a little surprised. "He asked me to. I guess he's been working with Petty Officer Harrison at the waterfront." "Colonel Haskins is working with the Navy, too?" I ask. "Apparently," says Randy with a shrug. "The Navy is really lacking in leadership. They probably need him." I nod. "Well, thank you for your assistance during the procedure. You were a lot of help." Randy perks up. "Hey, if you can save lives like this every day, I will gladly be at your beck and call." I grin. "Thanks." "No problem," he says. He gazes at me again, but this time it's different. "So," he says slowly without taking his eyes off mine, "should we go talk to the mother of angst?" "Who, Mrs. Harrison?" "Sure, I'm always looking for someone to scream at me. You must have heard about what happened yesterday." Randy lets out a deep chuckle. "Who didn't? But don't worry, she won't have a reason to hurl at you today." He smiles as he opens the door and gestures for me to proceed out of the room. "She'll come up with one. I say with a smile as I slip past him. Randy grins back at me. As it turns out, I'm right. The second she sees me, Mrs. Harrison launches forth with more accusations. Who do you think you are, giving my husband surgery without permission or credentials? You, Mrs. Harrison, I cry. There is no way I'm going to let her do this to me again, not after I saved her husband's life. I will not listen to you if you cannot speak to me in a civil manner. I'm surprised at how much I raise my voice, since I usually have the opposite reaction when I'm upset. Mrs. Harrison hesitates but presses on. But you have no right to what? Save your husband's life when he may have died within the hour? I knew exactly what I was doing in there. This isn't exactly true, but close enough. If you breathe out one more accusation against me, I will not allow you to be anywhere near this vicinity. By the time I finish my ultimatum, my voice is back to its normal tone, not particularly matching my words, but I can see that Mrs. Harrison knows I'm serious. The hostile woman glares at me. You can't do that, she says in an angry whisper. Yes, I can, I say, my voice firm and final. I'm suddenly aware there are several other people in the hallway, witnessing our heated scene, but I don't take the effort to look around and see who they are. I inhale a short breath. Now, if you wish to discuss your husband's condition civilly, I will be in my office. Or closet, I correct mentally. I spin away from the small crowd and march toward my office. I can almost feel everyone's eyes following me down the hall. Once I'm inside the tiny room, I put my fingers to my temples and make a conscious effort to breathe in and out. 4 blank walls surround me. There's a small ivory desk and chair sitting in the center, with an additional chair on the opposite side of the desk, for consultations, I assume. A tall bookshelf stretches up the side wall, almost reaching the ceiling. The bookshelf is what pleases me most about the room, as it is stuffed with books, journals, articles, and newspapers. Although there isn't much space, I suppose I don't need any more. Most of my paperwork will be kept in the medical records room anyhow. Leaving the door open, I slowly walk around my desk and plop into the hard chair. I fumble through Petty Officer Harrison's file that still lies on my desk from the previous day. I don't plan on reading it at the moment, but I need something to do with my hands. The adrenaline in my body slows, but not soon enough. I can't believe what I just said to my patient's wife. It's like a hidden part of me shot out without any warning. I had no idea it was even there in the first place. I like the feeling. I had finally taken charge. But it also makes me feel like a jerk. Mrs. Harrison has to be overwhelmed with her husband's situation. Okay, that is a total understatement. Her husband has been near death twice in the past 24 hours. Of course she would be a wreck. I've been in her place. I remember the last few hours I waited to hear if Ryan was okay. And he wasn't. I shake my head as if that would shake the memory. I feel like a hypocrite. Was I out of line? What else could I have done? I did everything I could for her husband, and succeeded. And she still treated me like a child who had stepped out in front of a bus. I don't want patients or their family members, or anyone for that matter, to think they can walk all over me. At the same time, I don't want to be the stuffy, prideful know-it-all who is inconsiderate and not understanding and doesn't listen to anyone else. Ryan always told me I need to stick up for myself more, put my foot down. And I think he's right, but every time I try to do it, I feel angry. Or guilty. I certainly feel guilty now. Ryan always told me there was no reason for me to feel this way, that I was usually more kind than I thought I was. Again, he may be right. But then, why do I always feel so rotten when I try to lay down the law? There's got to be some happy medium. Maybe I'm not doing it well enough. Are you all right? Says a familiar deep voice. I leap out of my chair. How did I not see or hear him come in? I exhale sharply, stand and salute the colonel. Colonel Haskins, I didn't hear you enter. He stands in front of my desk, peering down at me. Somehow he seems even taller today. I apologize. I should have knocked. Go ahead and sit. I sit back down. Are you all right? Yes, sir, of course. That eraser probably isn't. He motions with his eyes to the large pink eraser in my hands that apparently I have been using as a stressor. Immediately I thump it on my desk and lean back to look at the colonel. He sure is nice to look at. How is Petty Officer Harrison? He asks, closing the door behind him. His question immediately cheers me. He's good. He really is. He did very well during the surgery. His heart rate and blood flow and brain waves are all stable. His vitals look good too. It looks like he suffered some brain damage from the stroke, but it's mainly related to moving physically. Those things, however, he can relearn through some therapy. In my opinion, it's better than memory loss or difficulty with comprehension. I stop as I realize that the colonel might not care about all of these things. I study his face for a moment. He is gazing at me like he is surprised. I'm glad to hear it, he says, his voice warm. We need Petty Officer Harrison. Desperately. His voice drops on the last word, and he looks like he regretted saying it. I'm sure you do, I agree. Silence. Look, Private Andrews, about Mrs. Harrison, I don't know what my face looks like, but it causes Colonel Haskins to pause. I want to ask him if he was part of the small crowd in the hallway, but I already know the answer. Of course he was. The colonel motions for me to speak. What is it? I was just about to go apologize to her. I'm sure she is very worried about her husband. The colonel furrows his brow in confusion. I was going to tell you that I'm glad you put her in her place. You should have done it sooner. I fill my cheeks up with air and blow out slowly. You're probably right, I say, knowing there is no way I could disagree with a lieutenant colonel. I stand and walk around the desk. He shifts to face me, his countenance never changing. This man looks like he has many secrets. Secrets he will never share. Have you ever performed a surgery before? He asks. I'm a bit taken aback by his direct question. Yes, actually. I've performed 4 surgeries. When I was an intern in graduate school, but they were all on an eye, I explain. Eyes? A gleam of intrigue cracks his solemn stare. Yes, I was studying to be an ophthalmologist. I was drafted about a semester before I was to get my MD. The colonel frowns, but quickly wipes it away. Well, here in the Army, you can consider yourself a doctor. You've certainly proved yourself capable. Although he gives no smile to accompany the compliment, I notice a flicker of admiration in his eyes. That's good enough for me. I smile. Thank you, Colonel. That's very kind of you to say. By the way, do you know why we don't have an actual doctor on this base? Heaven knows we could really use one. We do, he says pointedly. I laugh a little breathless. Thank you, but you've just removed a blood clot and cleared up an artery. You're a doctor, the colonel says. Who cares about the certificate? I'm rather surprised to hear him say this. A smile is now playing around his lips, and his eyes are growing brighter by the second. At least I think they are. I don't know what else to say, so I changed the subject. I think it's time I spoke with my patient's wife. Of course, he agrees, opening the door for me. Go ahead, doctor. He keeps a straight face. I can't help but smile as I walk past him. He is certainly acting different today. But of course, it could just be me. And that concludes Chapter 8. I hope you enjoyed it. I hope you join me next Thursday for Chapter 9, which is called Secrets Revealed. Until next time, take care.